In this presentation, we are going to talk about developmental milestones. So we all know that children develop as they age and as they interact with their environment. So developmental milestones are physical or behavioral signs of development of infants and children. So this includes things like physical growth and psychosocial development. Milestones will develop over time, and they provide important information regarding a child's early development. An easy way to think about milestones are things that most children can do by a certain age. And genetic and environmental factors can both affect development. So when we're thinking about genetics, these could be things like chromosomal properties. And unfortunately, those can't be changed. That's what you're born with. That's your genetic makeup, your DNA. And that can affect how one develops. Certain genetic disorders may be passed down from parents to their children. And genetic makeup plays a part in determining physical size, intellectual ability, personality traits, and other things. Some environmental factors that may affect development include things like some of the earliest things that a person may encounter would be maternal drug use, whether that be illegal or legal while in utero. Also, alcohol use can affect fetal development. Other environmental factors include birth trauma, illnesses in early childhood, socioeconomic status, access to food and nutrition, and access to academic environments such as preschool. Also, things like growing up in a chaotic environment versus a structured family environment. All those things can potentially affect how a child grows and develops. Now let's talk about the role of the nurse. Nurses should be familiar with patterns of normal growth and development so that way they can be able to detect when delays are present. Oftentimes, the nurse is the healthcare provider that spends the most time with the child so that they may identify these delays quicker than maybe the pediatrician would, just because you're spending more time with that child. Nurses should also ask the parents if they have any concerns about growth and development, and they should assist with screening tools, which we'll talk about in a little bit. It is important to identify developmental delays as early as possible so that we can start early intervention. So what early intervention means is that we find appropriate assistive services to aid the child in staying on track with their development or catching up to other children their age. Nurses should understand that the exact age a child develops or performs certain skills will vary. So one child might do something at 4 months that another child is able to do at 6 months. And that's okay. But the sequence or order that the skill performance happens is uniform among children. So basically what that means is every child should crawl before they walk, regardless of the age that they do each of those things. The last thing on this slide says provide the child with appropriate toys and experiences. So some examples of that, some small toys may not be appropriate for children who are developmentally delayed. So you may think one toy is appropriate to give a 4-year-old, but maybe that 4-year-old has some cognitive delays and they try to keep putting that small toy in their mouth. That would not be appropriate for that child based on their developmental level, not necessarily their age. Another example would be you wouldn't get a child who can't crawl a little lawnmower push toy as a gift or as something to play with in the playroom, because that doesn't add up to where they are developmentally. Screening tools are things that we are going to use to help identify developmental delays. Developmental screening is the administration of a brief standardized tool that aids in the identification of children at risk for a developmental disorder. It's important to note that these are not diagnostic tools, so they're not going to diagnose a certain condition or developmental problem, but they are screening tools, so they will help us identify that so that then they can receive further evaluation and a true diagnosis. It is important that all children be screened using a validated test during well-child visits at 9, 18, 24, and 30 months of age, even if there's no concern about their development. And some places may screen more frequently than this. This is just like the standardized rule of how often they should be screened. One example of a screening tool that is very popular is called the Ages and Stages Questionnaire. You might hear it abbreviated as ASQ. And it is a form that a parent will fill out, and it'll ask them questions. And the parent will base their answer on how their child is developmentally. It'll ask things about motor skills, cognitive skills, social skills, and it takes about 10 to 15 minutes to complete. So it'll ask questions like, can your child hop on one foot unassisted? And there will be answer choices of yes, sometimes, or not yet. And the parent would just circle which one applies to their child. It also has a section at the bottom that allows parents to write in any concerns about language, hearing, vision, or motor skills. And then after the parent completes this, the healthcare worker will score the child based on the parent's responses. And based off of those responses, they may identify a potential delay in development, and that may suggest further evaluation is needed. If further evaluation is needed, the primary care doctor or healthcare provider will likely refer that child to a specialist who can give them an accurate diagnosis and perform more tests based off of whatever the delay we identified was. One very important thing to remember is that a loss of skills at any age is cause for concern and requires further evaluation. These are some examples of the different types of skills that we look at when we measure growth and development. So you have gross motor skills, fine motor skills, language skills, cognitive skills, and social skills. So please read over these and it'll better define what each of those things are. Now we're just going to go through a few ages of children, and I'm going to give you some examples of developmental milestones that children at that age should be meeting. So let's start with 2 months. So 2 months old, this child will begin to smile purposefully. They notice their surroundings, so they'll start looking around, looking at people, kind of tracking people with their eyes. They'll watch objects, maybe like a ceiling fan that goes around or something with bright lights that draws their attention. They'll also start to coo or gurgle, so make little noises with their mouth. If you've ever been around a 2-month-old baby, I'm sure you can understand what I'm talking about. They also, as far as motor skills, should be able to bring their hands to their mouth, and that should be both hands, not just one. If they're lying on their stomach, they should be able to lift their head unassisted, at least for a few seconds, and look around. And they should be able to move all their extremities independently. Children who are 6 months old will start to recognize familiar faces, so people like mom and dad or their sibling. They should also respond to their name. So if they hear their name called, they may turn and look at the person who said their name. They'll make sounds to communicate. The 2-month-olds, remember I said they're going to coo and kind of gurgle, but they're not really necessarily purposefully communicating. By 6 months, they can start making babbling noises and imitating sounds that they hear from other people, but they don't form any words yet. As far as motor skills, they can grasp and pick up toys. They will reach for objects that are interesting to them or that draw their attention. They should be able to roll over in both directions, and they should be able to sit unassisted. 12-month-olds or 1-year-olds, these children should be able to communicate with simple words. They will usually know like 1 to 3 words, things like mama, dada, bye-bye. They will also have favorite toys and favorite people, usually the parents. They will be able to play games, simple games like peekaboo or patty cake. They can perform gestures. So what I mean by that is they can wave, clap their hands, shake their head yes or no. Motor skill wise, they should be able to place objects into holes. Have you ever seen those toys that, you fit the shapes into certain holes? They might not get the shape correct, but they should be able to at least place the object through the hole. They should also be able to stand alone, and some 12-month-olds will walk independently. And they should be able to sit down or squat from a standing position. By the time a child is 18 months old, they should be using 6 or more words to communicate, and they may communicate using 2-word phrases like I eat or I play. This is the time when you may see stranger anxiety appear, so they may be reluctant to go to people who aren't their parents or who aren't their grandparents or people that they don't really know very well. They will also play pretend. They also tend to like to play with puzzles and blocks. They will hide and find objects. They will point to objects that they are interested in or objects that they want to play with. They should be able to use a spoon and cup to feed themselves. And by this age, they should be walking independently. As far as social skills, this is the age where they start to become interested in other children and start to play with them. So now let's jump ahead to 3-year-olds. 3-year-olds typically show affection to others and have a wide range of emotions. If you've been around 3-year-olds, they are usually pretty touchy and hands-on. They like to give hugs and sit in your lap. But they also have temper tantrums quite frequently because they can't understand, why they're being told to do something that they don't want to do. That's why you hear about the terrible 2s and the terrible 3s. Other things, they will play pretend a lot. They have big imaginations. They should be speaking in sentences by this age. They should be able to color with a crayon and be able to copy simple drawings. So if you draw a circle, they should be able to copy that with their own crayon. Or if you draw a straight line, they should be able to draw that straight line as well. They are also able to dress and undress themselves. They can walk up and down stairs. They can pedal a tricycle. And by this age, children should be interested in potty training if they're not already potty trained. So this chart that I put on this slide is just from the CDC. It's like a little journey that goes through childhood development and developmental milestones. You can look over it if you would like. But in conclusion, I just want you to know that the nurse plays a huge role in identifying and evaluating developmental milestones, and that early intervention for children who experience delays, particularly before they start kindergarten, has a huge academic, social, and economic benefits. So what I mean by that is that children who receive early intervention for developmental delays are more likely to graduate from high school, more likely to be employed, and more likely to live independently in the future.